Hello, everybody. Welcome back to the World at the Moment podcast. If you're new here, my name is Krish Call. I'm just about to start college, and I'm a person that likes to explore and do a deep dive on issues regarding the health, social, or financial aspects in the world. And this is going to be a bit of a different episode because a bit regarding mental health. Viewer discretion advised talks a bit about suicide because just recently a study came out in which there's been a rise of preteen suicide rates since 2008. According to the study, this was roughly an 8% increase, predominantly in races such as the Asian American community, the Native American community, the Hispanic community, and this was largely affecting girls, female preteens, but still a big problem overall. From the way I see it, suicide, it's not the answer. It's, I'm not sure everybody knows, and I think it's important to know that suicide is just a permanent solution to temporary problems. And I think it's sad because we're seeing people die at such a young age, especially people who are just in elementary school, barely starting middle school, who are now pushed to such a limit that they feel like they're cornered, that they feel like suicide is their only option. It's shocking because especially when you consider how much spending we do as a country. We're a country that probably spends the most on their healthcare systems compared to our peers, and yet this is the performance we are yielding. I think it's shameful to our country, shameful to the way our healthcare systems. Clearly we're not doing enough if it's no longer just adults who are being pushed to suicide, but also kids as well. And there are a lot of reasons behind what may be the driving factors with this. I think for our country, we are living in a more isolation. I feel like we're living a lot more distant from each other. I think culturally, there isn't that much unity as there should be. I mean, even if we start at the family level, our culture is when the kids are older, they move out. Everybody moves out, everybody disperses, spreads out. But it's not about staying together in one house. It's just, okay, kids move out. That is our culture at the moment, and I think that might be an issue with the cause of suicide because, suicide, ultimately it takes a lot to push a person to get to that point. And I feel like a lot of the problems that they may be facing, a lot of the times they feel cornered, right? As I mentioned before, these are people who feel cornered with the problems that they face, which is why they start taking drastic measures like suicide. And I feel like such problems could be better approached, better mitigated if these people had someone to talk to. And I think that's a big problem that we have in America right now. We all feel alone in the problems that we face. We all feel like life will go on, but the problems won't disappear. So I think that's one reason as well. And it's certainly, COVID has not helped the situation at all. If anything, it's exacerbated the situation as well because a lot of kids had lost their parents because of COVID-19. And it displaced many people's lives. There was a lot more homelessness, a lot of unemployment, all just stresses, additional stresses being placed in the household that the child just cannot ignore. And now it's creating this big burden on themselves as they try to navigate through their childhood with these, difficult emotions. And another kind of cause behind this is according to the American Psychology Association. They're stating how kids these days are facing puberty at a much younger age compared to before, and I feel that that might be the reason why, you know, they're dealing with such complex feelings at such a young age. It's difficult to process them and understand them. But, you know, overall, I don't think it matters, you know, about the causes of mental health. Because from what I see, I think it's just, it all ties back into our healthcare system in the end. Because, like I mentioned before, we live in an isolationistic society in a way, where the culture is all about spreading out, moving away from the people, so that you can go find your own roots. And that's good, but I feel like when it comes to when suddenly, you know, stuff takes a wrong turn and we're all facing problems, we feel cornered. We feel like there's no one to turn to, and I think that's something that we need to work on. But there is some hope, though, in which we're seeing now a lot more adolescents are receiving mental health treatment compared to before, when mental health was completely stigmatized. It's good to see that people are seeking treatment. They are finding someone to talk to. And I think it's a step in the right direction. I think we are working to mitigate this problem, but still, it's very shameful to have such a study come out and reveal that we have this kind of problem in the United States as a first world country. Like, this is unacceptable, and I hope our leaders in healthcare, our leaders in DC, you know, they do what they need to do to help make this right. That's all I have to say about it. If you like this episode, you can check out the rest of my podcast. Like I said before, I've published a bunch of health, social, financial events, that sort of thing. If you like this episode, you can comment down below. Let me know your thoughts on this too, because it's honestly a very shocking study to me to read about this. Thank you, and bye-bye.